It is a bucolic backdrop, the sort of place where the Main Street barbershop is still the hot spot. But the Appalachian region of eastern Kentucky is a place that has been dragged through decades of a crisis that has ruined generations of families.
There's a lot of dealers everywhere.
Hepatitis C and HIV rates have spiked because of sharing syringes. Kentucky has a syringe exchange program, but only about half the counties in the state have exchange locations. Wolfe County, Kentucky, is the #1 most vulnerable county in all of the United States for hepatitis C outbreaks. Nearby Bath County, where Jason York is the emergency management director, ranks 125th.
Everybody knows someone.
He says opioids are crippling the local economy. That money used to maintain and improve the town is going to the jail, overflowing with people incarcerated because of opioids.
Our county's jail bill in 2014 and 2015 rose in 2017, 2018, 119% to just over $500,000. Now that's money that normally went to fixing roads, implementing social programs, employment, and it won't go there because it's going to a jail bill.
This is a community with some of the highest overdose rates and drug-related arrests in the county.
Dr. April Young from the University of Kentucky has been doing substance use research in these rural communities for 10 years. Not far from that Main Street barbershop is a neighborhood in crisis in Moorhead. And Young needed to recruit participants from it for a study she and her team are doing with Emory University.
We bought a grill and a tent, and we staked out cookouts around local neighborhoods, including this one. And at first, people thought we were crazy for standing in the parking lot and grilling hot dogs in the middle of the summer. But then when they learned more about the study, they were appreciative that we were there to hear their stories about substance use and how their families had been impacted. So they helped us spread the word, and that's how this entire study began.
Emory and Kentucky are collaborating on the project called Care to Hope, studying community responses to the opioid crisis. Kentucky is ranked 9th in the United States for opioid overdose deaths. Georgia is 30th. 1 year earlier in 2017, Georgia was ranked 11th in the nation.
We've developed these coalitions, so there's 72 people involved in coalitions across 12 counties who are guiding the project. And then we've recruited 300 people who are actively using drugs, who we follow over time to study how their behaviors change and how hepatitis C and HIV changes over time, and how we can reduce their risk factors.